Hello everyone, Katya here from The Functional Horse. In today's video, we will be talking about how to recognize tension in your horse's body. Musculoskeletal issues that stem from tightness and tension in the muscles and fascia are unfortunately extremely common in horses. They can happen due to several different reasons, from poorly fitting tack to poor riding practices, old injuries that weren't rehabilitated properly, natural asymmetries, and so on. It is a very long list. Tight muscles and tight fascia can lead to more serious injuries in the long run. And not only that, but they also make correct movement difficult for the horse, which will obviously impact his willingness and his ability to work because no one wants to exercise with a sore back. So in this video, we will be looking at 4 ways that you can assess your horse's muscles and his fascia to spot any tightness and dysfunction early on. So first, let's just look at some general guidelines for assessment. Recognizing early signs of discomfort and tightness is not particularly difficult, and with some practice, I believe that any rider and horse owner can learn how to spot some of the more common problems. When assessing our horses, we do need to follow some general guidelines. Never forget that the areas we will be looking at and touching might be painful, so keep that in mind. This means that there is a chance that the horse will react in an unpredictable way if touched or squeezed too hard. So be polite and keep your touch gentle. To reduce the stress and the potential danger to us and our horse, we need to pick the right time, the right space for assessment. It's best to do this in an environment the horse is familiar with, somewhere where he's relaxed, somewhere where he can focus on what we are doing. So ideally, we would have a helper to hold our horse. If we don't have a helper, make sure that we don't firmly tie our horse because some horses can react by pulling back. So just make sure we avoid that situation. With every assessment, it's important to touch the area we will be assessing gently with an open palm before applying any pressure, because in this way we are letting the horse know where we will be touching him and we avoid any surprises. Always be mindful of where you are positioned. Make sure you are not in kicking range. Make sure you are not in biting range. That's where our helper comes in to help us with that. Not a lot of the horses will react by biting or kicking, but some might, so just be careful. And then these 4 techniques, they are in no way a complete assessment of the horse, and they should never ever be used to substitute veterinary attention and diagnosis. If your horse is showing signs of pain, lameness, or discomfort, always consult your veterinarian first. So the first area we will be looking at is the poll. This area can often be quite tight because the small muscles surrounding the junction between the head and neck are small and sensitive and unfortunately often overworked. Pole issues can stem from old injuries, from falls and pullbacks, from teeth issues, thoracic sling issues. But probably the most common culprits are bad riding techniques, like improper use of side reins and just general riding with too much rein pressure. When we are assessing the pole, just observing it can give us a lot of information. Overdeveloped muscles surrounding the pole, which appear as a bulge just here behind the ears, are a sure sign that the horse is using these muscles too much, which means he is probably carrying a lot of tension in this area. Another red flag is a generally unevenly developed neck musculature. So whenever we see that the neck seems more developed and thicker closer to the head than to the shoulders, this is a red flag. It means that the horse is not using this part of his body correctly. So for the palpation part of the test, we will stand next to the horse's shoulder and take hold of the halter with one hand. We will then place the palm of the other hand on the pole just behind the ears. And then if the horse is okay with our palm just hanging out there, we can then use our fingertips to gently press into the pole muscles. The key word here is gently. Watch for the horse's reaction. If he has any discomfort and tension in the pole, he will most likely raise his head, try to evade the pressure. Some might even pin their ears back, swish their tails, or even try to bite. These are obviously all signs that this area is painful. Another important thing to note is how the muscle feels under our fingers. A healthy muscle feels soft and elastic, kind of like our front thigh muscle. So when the muscle feels firm and has no give, we are most likely dealing with a dysfunctional pole. Next up, we have the thoracic sling. The thoracic sling is a very complex area of the horse's body. The term thoracic sling generally refers to the muscles that attach the front legs to the axial skeleton, so to the rest of the body. This area will start to show signs of tension and discomfort whenever we have hoof issues, again, improper riding techniques, ill-fitting tack, or any kind of lower limb injuries. Now, before we start touching the muscles, let's first take a look at the area. Now, two very obvious signs of trouble are an overdeveloped lower neck muscle, the brachiocephalicus, and a dip in front of the withers. At this point, I would just like to point out that the brachiocephalicus is not a part of the thoracic sling per se, but it is connected to its function or its dysfunction. So it can tell us a lot about how the horse uses the actual muscles of the thoracic sling. Now, another sign of trouble are overdeveloped muscles just in front of the scapula, and we will often see fascial lines in this area if there is dysfunction. And the next thing to look at is the horse's front limb stance. If his front legs are positioned far behind the body, under the body, this is also a sign of thoracic sling dysfunction. So for the palpation part, we will be focusing on the brachiocephalicus. We will place our hand around the muscle belly and follow it down to the base of the neck. Now, when the horse is okay with our hand just being there, we gently squeeze the muscles. Some horses can react quite a bit to this by tossing the head, by moving away, so be prepared. Usually they will lift the head up and hollow their back, and this kind of reaction is a sign of tension. Now, in my opinion, the natural muscle tone of this muscle is lower than that of the pole muscles, which means that the muscle should feel even softer, really soft under your hands. If it's even a little tight, it's a sign of tension. Okay? And one thing to keep in mind is that pole issues and thoracic sling issues very often go hand in hand. Next, we have the back. Back pain is extremely common in horses, especially because they are often the mirror of dysfunction elsewhere in the body. Unfortunately, back pain often goes unnoticed. The back is a bridge between the front end and the back end, which means that any tension in the back will negatively impact the function of the legs and vice versa. There are many reasons for back pain in horses, everything from an ill-fitting saddle to old injuries, compensatory patterns, unnoticed lamenesses, especially in the hind end, poor rider balance, poor riding techniques, and so on. The symptoms of back pain are quite varied as well and can be quite nonspecific. Often riders first notice small behavioral changes and poor performance. So when looking at the back, the most obvious thing to look for is atrophy of the long back muscle. When the long back muscle is healthy and well developed, it evenly fills out both sides of the spine, so the spine isn't as noticeable anymore. The edge of the scapular cartilage will melt seamlessly into the back and won't be very obvious. And when the muscle is atrophied, we will be able to see the edge of the scapular cartilage very well. And we see it here. And the triangle between the scapular cartilage and the withers. So this pocket here will be empty. Naturally, the long back muscle will not be well developed in horses that aren't working or horses that are too thin, as is the case with the horse on the photo. But if we see atrophy of this muscle in horses that are in regular work and otherwise in good condition, this is a huge red flag. When palpating the horse's back, be sure to stand closer to the horse's front end, just in case the horse decides to kick out. So first, what we're going to do, we're going to run the palm of our hand over the length of the back a couple of times, just to make sure the horse is okay with being touched in that region. When the horse is okay with that, we run our fingertips gently along the muscle, about 3 centimeters or an inch away from the spine. Be aware of the horse's reaction and the feeling under your fingers. Any tail swishing, moving away, hollowing the back are signs of tension. And just a little note here, if you press hard enough, even a horse with a healthy back will dip his back, so make sure the touch is gentle. And when there is discomfort in the back, the muscle will often feel rock hard, and it might even start to twitch under your fingers. And this is usually more pronounced in the lumbar region. Okay, and finally the hind end. Pain and discomfort in the lumbar region is often a sign of hind end issues. Now, the pelvis attaches to the back through two relatively small and immobile joints, the sacroiliac joints, which serve to transfer a lot of forces from the hind end to the front. So no wonder a lot of issues can stem from the pelvic region. Factors that contribute to issues in the hind end are poor saddle fit, being worked too hard, especially jumping youngsters. Again, old injuries of the distal limb and slips and falls, which with horses very often happen, especially in the muddy season. When looking at the pelvis, a hunter's bump would be a sure sign that something had happened to this region in the past. Look for any asymmetry in the tuber sacralis and the tuber cocci. They can both be a red flag. Especially if asymmetry in muscle development from left side and right side is also present. And any unevenness in the muscling is also a sign that the horse is not using this area correctly. Usually what we will see is too much development in the hamstrings and not enough development in the quadriceps. So too much development here in the hamstrings and not enough here on the side quadriceps. When palpating this area, we need to first locate the tuber cocci, and then while standing as much to the front of the horse as possible, find the cranial edge, so the edge of it that is facing the head, and gently press just next to it, gently. So a horse with hind end dysfunction will follow his back. You might see muscle twitches. He might be moving away. All of this are signs of discomfort, especially discomfort in the psoas muscle, because usually when we have issues with the hind end, there will be some degree of psoas dysfunction because it is a very, very important muscle of the hind end. So this is what we are checking for with this test. Okay, so what next? First of all, keep in mind that these 4 techniques are in no way a complete assessment protocol. They are just some simple checks anyone can do to get a general idea of what's going on in the horse's body. Tension and discomfort in the body lead to injuries, lead to chronic issues in the long run. So dealing with small problems in the muscles and connective tissue is very important. Horses are masters at hiding their pain, so we need to pay attention to the smallest details. Any behavioral issues, poor performance, and uneven muscular development are huge red flags that we really need to take seriously. It's really important to create a picture of what's normal for our horse, so I suggest implementing these techniques into your daily routine to get a feel for what's normal. Now, some horses naturally have a higher muscular tonus, some are naturally more or less sensitive. So try just feeling your horse's muscles and his fascia every time after brushing, or whenever you have time or whenever you think of it. And in this way, you will develop a feel for what's normal, and then it will be easier to recognize when something stops being normal. If we come across regions with discomfort, if we come across big reactions from our horse, it is time to call in a skilled body worker. And then he or she can help us with minor issues and give us advice on preventative measures, because keeping the soft tissues healthy is key to maintaining health and well-being. Thank you very much for watching. I hope to see you again soon. For any additional information, visit our website at thefunctionalhorse.com. You can find us on Facebook, Instagram, and Twitter, and be sure to subscribe to our weekly newsletter. See you next time. Bye.